My name is Aglaury Núñez. I work at Salud Family Health, the Director of Training here at Salud. Salud is a primary care clinic, so yeah, mostly that's what I specialize on. Let's see. So today we have a discussion around screening tools to use with Spanish-speaking speakers and patients who speak Spanish as their primary language. I have a presentation, but I don't know. I'm gonna share it anyways, just so we have that as a way of reference. Cool. See if I can. Okay. Before that, let me stop sharing real quick. I apologize. Can everyone else in this meeting, can you guys introduce yourself as well and kind of your background so I know a little bit more about you guys?
Hello.
Hello.
Hi. Good afternoon. My name is Ana Cecilia. I am from Puerto Rico, and I practice both here in a cancer hospital, as well as I'm also a behavioral health consultant for a clinic in Pagosa Springs, Colorado.
Okay.
My name is Josie. I am a case analyst for one of the behavioral health teams at the University of Utah. Also a community health worker, and thought this would be helpful.
Great. Very nice to meet you both.
My name is Michelle. I am a psychologist in Rhode Island. I do BHC work in a primary care setting, and then I'm also in a specialty clinic for children with neurodevelopmental disorders.
Great.
I'm Federico Mendez, marriage and family therapist in the Dallas-Fort Worth area in Texas. I'm currently in the PhD program at Texas Women's University in Denton. And I've recently joined CFHA, and then also I have an interest in chronic illness, Spanish-speaking population. That's what I focus with, is Spanish-speaking and LGBTQI population in private practice. But I'm maybe going that medical route due to a personal journey with my own family of origin. And this piqued my interest. So I'm definitely interested in what you have to offer and further my education and submersion within CFHA to see what we can do.
Great.
My
Very
name is
nice having
Daniela,
you here.
and sorry,
No,
and
that's fine.
I'm a social worker in Missouri. I am also our first BHC at an organization called Casa de Salud. And so we serve immigrants and refugees and folks that are uninsured in general. So just kind of looking to see what other clinics are using for assessment tools, since we're just kind of starting at the ground and trying to build up our program.
Mhm. Well, is that everyone? I think I have Jordana, or was
Hi, everyone. My name is Jordana. I'm a psychologist at a federally qualified healthcare center, also in St. Louis, Missouri, and providing BHC work for a primary care clinic. And we serve a very large Spanish-speaking population.
great. Great. I don't know if Dr. Rukendo is able to introduce herself. Are you?
Yes. Hi.
Okay.
Hello, everybody. I'm double booked in meetings and calls, so I apologize. We'll try to be present here as much as I can. Jairo Kendo, I'm the Vice President of Medical Services at Salud. I pretty much run the behavioral health subdepartment, and I have been the Serving Latinx Populations Task Force leader for 2 years already, I think. So I'm glad to see new people here, and I hope we can continue the conversation.
Great. So I think we could do it since we're all here in working already, right? And using some screeners and tools already. I think we could keep it more as a conversation, right? And see what you guys use, and I can share what I have, and maybe later I can share some of these tools and where I can find them in the internet as needed, right? Some of them are of public access and use, so you don't have to pay for them. Some of them you have to take, you know, a little bit of a course or certified in it, like, but pretty much very simple. So do you guys would you like to start by topics, or like depression, for example, first, and we kind of name and talk a little bit about what you use, and both in adults and children, and then we move on like that? Yeah. So I think the most easy ones sometimes could be depression and anxiety, I guess, in adults at least. So one of the questionnaires to start with anxiety. We use the GAD-7 to screen for anxiety in adults. And then I have also used for children the Spence Children's Anxiety Scale for children. Both give a lot of information. The Spence I like because it gives you a lot of information about different types of anxiety that a child could be experiencing, and it kind of divides it or as you score it, and tells you a little bit very valuable information about what they are experiencing. What do you guys use, or what can you recommend to I think it was I forgot the name. Let me write it down here. Look for it. Was Daniela? You were the one implementing, right? Implementing a new thing. So
Yeah,
yeah.
we use the GAD-7, the PHQ-9 for the adults, and just like the translated versions. I think what I'm having most trouble with is like an outcome measure for like specifically BHC work. Since it feels like I was directed in the direction of Promise 10, but it's just so long, and I don't think that it's quite health literacy friendly. And so yeah, just wondering if anybody has anything that they use that they really like.
Let's see, what do you guys use in your clinics regarding outcome measures? I think we here at we use in my clinic we use the outcome rating scales and the session rating scales, which we call the ORS and SRS, and it's really nice because they have like it's aligned, right, and they have 4 areas of their lives where they kind of rate within a spectrum, and you know how they're doing today, and then depending on your health record, you can maybe pull that data and compare it and show them, right? Like, hey, this is how you rated at the beginning, and this is how you're better, and all that. But yeah, I think you can search it. Obviously that has a cost, and they are also both. They have one for adults. The adult version. They have a children version as well. Parent version. They have a session rating scale that you can use after each therapy session or session that you do. For adult children as well. And I find it really helpful. They have oral, verbal, or that you can use if you're providing telehealth. So you should definitely check that out, because it can be really helpful, but you do need to purchase it as a depending on behavioral health providers or providers or clinicians that are going to use it and all that. And but I really enjoy that one, and I think it's really easy to understand for most patients that are both in Spanish and English as well.
Can you say the name of that again?
It's outcome rating scale. I'm trying to see if missing, if I can find the name of the yeah, so it's abbreviated ORS or SRS, and then it's Scott Miller. So I think if you go to scottmiller.com, you might be able to find, maybe not, because I feel like this is taking me somewhere else, to be honest, but not where I wanted. But I can definitely try to find it and send it, because you can, once you purchase you can, they're going to give you like access to different ones. The only thing with it is that you have to measure, right? Since it's a line, you have to measure the line and provide. It's really interesting. So, but I encourage you to check it out because it's really interesting, but it's really useful too.
So that's similar to the PCOMs in the sense that with the written, it's kind of like a ruler, and the verbal is a scale. Is that right?
Yes, yes. Basically, it is.
Okay.
Yeah, I can share it real quick. Trying to find this. Share screen. So share it. So yeah, it's like that. So basically, they're supposed to meet from, this should be 0 and this should be 10 centimeters, right? So they would mark it, and then you would individually score like how much did they do in each and sum it up, and depending on that score, they give you a cutoff point, which is different for each age, right? But you can see it here for the sessions, and then for kids, and then they have one for younger, but we don't necessarily use that one. And then they have it both in Spanish and English as well. This was what we use. We have them laminated, which makes it easier. So to use and reuse. So it's really, yeah, something that you can.
Thanks.
Let me stop sharing. Cool. So any other tool that you use or your clinics use for that type of information? No, I think that's one of the hardest sometimes, right? How do we measure outcomes? How do we measure quality and this and that? It's difficult, but at least there are a few tools that you can use. You mentioned the good. So let's see. So obviously, do you guys all see children as well, or just adults? Oh, I have something here. Sorry, I've been reading the chat. Okay. Okay. How do you spell? Okay, let me write it. I'm not too good with multitasking, but oh man. Cool. So yeah, for children, I think there's tools as well. Here we use the PSC, Pediatric Symptom Checklist, more in general, PHQA, and then the CRAFT for substance use. But let's see, and anxiety, like I said, and depression are kind of easy. What do you guys use for PTSD? So I noticed that there could be different things that people might use. We use the PTSD checklist, but I wonder if you use anything different than that. It's both in English and Spanish too. So is that what you guys use? This Federico and Daniela, I saw some nods.
Yeah, I think
okay.
we just use the abbreviated version of the PCL5, so it's
Yeah,
not
that
as
one, yeah.
lengthy. Yeah.
Good, yeah. And I think it covers a lot, even though it's not as lengthy, it's lengthy enough to provide good information about what might be going on. Great. I'm gonna leave the fun one for the last one, or that is ADHD. I feel that's a hot topic lately, right? Do you guys do anything with bipolar disorders? Do you guys use any screening measures for that? Like mood disorders or anything? Not typically, right? Because I think what we typically do is it's kind of do a more thorough evaluation with those. But there is a questionnaire that I found that's called a mood disorder questionnaire that you can, if you need, you can use to kind of see if assessing further could be helpful. And it seems to be in both languages as well. Let's see. What do you, let me look back on my notes. Who was, I think it was Josie. What do you use for kids in autism and because I heard that there are different ones too. We use the MChat, but I heard that there was another one that could also be used. I don't know if you can share a little bit about that. Not to put you on the spot.
Well, I'm not sure. Most of what I utilize is like the PHQ-9 and the Columbia scale for the work that I do. I know it'll be different for our therapists that work within the community clinics.
Oh, okay. But yeah. Okay. You say you were with the developmental, right? Or am I confusing?
Oh no, I work for the University of Utah, just doing depression screening.
Oh yeah, who's a developmental?
Was it?
I swear I heard someone said that. Maybe not. Good. That would be so yes, I don't, let me see. I think I wrote it here. So there's for autism, I mean, do you guys screen in those who are in primary care? Do you screen children as well, or do you typically focus on adults? Can you find if there's anything in there? Oh, sure. Only with adults. Okay. Okay. And what about you, Daniela? Your program, is it going to be focused on adults, or you want
Just adults?
Okay. So we can focus more on that then, so we don't have to go, because kids have other type of things that they can be using as well. Okay. What about memory and memory concerns? Do you screen for that?
I use slums for that, for
slums, right?
cognitive impairment.
Why do you know why, or like can you provide a little bit of information why you feel like it's, because we use MoCA, right, the Montreal Cognitive Assessment, but I know there are a lot of
yeah, honestly, that's just, I came from a background of long-term care, and the slums actually was developed at St. Louis University. So that's what my previous organization used, and that's what I feel like I'm most comfortable with. But I also know the mini mental status exam is something that's often used around here. So those are the two options that I've come across.
Okay. Yeah. I heard a lot of people transitioned to the slums because the MoCA now requires certification, and then you have to pay for it. So I guess it's one of many reasons why people might, but I think both are really good to use within primary care. They both work well and are easy to use. The mini mental, from the last conversation I had and readings I had about that, was not as was not as sensitive, right, as the other ones. So if you have access to those two and you can do that, they will be preferred. But definitely a lot of people and medical providers and even use that as a tool. Great. So let's see, we have already substance use. I think, I don't know about you guys, but there's the DAST and the audit. That's what I would say most people use as well to measure that. And then, do you guys use the Columbia for suicide? How has that been working for you guys? More or less. We started implementing it here, like a protocol with it and all that. So it's ongoing. It has been really helpful to have a kind of uniform way of asking these questions. But definitely there are two versions of it, so it's also depending on which one you use. But I do feel that it's a good one to make sure that you're asking the questions in a way that you really want to capture what you're trying to assess. So now, I mean, what questions do you have? Like, is there anything in particular that you're interested in knowing more about? Like more other type of assessments, or like Daniela said, specifically for outcomes, like anything else that you guys would like to know or share? Nope. Good. Okay. So I'm gonna share a little bit like what I had, kind of summarize it all. I know you already use a lot of things, but I didn't include outcomes. I don't know why, to be honest. And don't necessarily include it. Didn't include it here, but they're there. So this is all I found. Specifically for adults, right? Like there's the most used. So like you said, for anxiety, depression, postpartum depression was someone that I think a lot of people use as well. PTSD, there was this screen, I couldn't actually find it in Spanish, but I did know it's available, but I couldn't find it, to be honest, which might be not really available in Spanish. And then the PCL5, as you guys said. And for ADHD, that's the one I was missing. I feel like a lot of people are coming to primary care wanting to know if they have ADHD, right? And depending on where you're working, you might have a different protocol on how to do that and how to assess that. And some clinics might part of your role could be signing and assessing and assigning a diagnosis. Other people might say, right, you need testing for it and so on. So there's a lot of different ways, but one of the things that I heard some of the clinics use is the self-report scale for ADHD, which could be tricky, I would say. I have heard some feedback from other providers saying that, well, people read a lot these days, or TikTok like shows them a lot. So they might not know, right, what to endorse, or they have heard what that is, and maybe asking for examples and being more thorough could be helpful. This is the ones that we talked about. This is, like I said, some of that I found in case we needed to find them today quickly. And for children, even though you don't see children, just know that there also are other tools that you can use that are available in Spanish. Starting with babies, right? Here we screen babies from 1 month old to adulthood, So either school tools that you can use to assess certain things within the family system, the baby itself, and things like that, and catch things early. And depression is disruptive behavior such as ADHD. We can send to parents and teachers too. And that's all I had, to be honest, with regards to that. Is there anything else you guys would like to add?
I was just wondering, what about the ACEs? Could that be useful in that to kind of capture that information as well too?
Or let's see. Yeah, let's see. Do you use that?
Yeah, I have an English version. I haven't found one in Spanish.
Hmm. Yeah, I don't know if it's in Spanish. I have to search. Has anyone else used it?
I haven't used it personally, but I think that there is an open access version in Spanish because I think some of our therapists use it.
Yeah. Yeah.
So hopefully it should be translated on the ACES
Mhm,
website, I
mhm.
would hope, but
Yeah. There's also the DIVA or DIVA that there are, I don't know what version is the current one right now, but technically yes, it's a semi-structured interview where you ask symptoms and also ask for you also ask for examples of things during childhood, so you can actually determine a little bit more of how that does that look like for that patient. So there's someone in the chat saying that yep, it is available, and share it here. Let's see. Yeah, and shared it. Okay. Okay, yeah. This is the ACEs for, that's what I was confused too, because it says for adverse childhood experiences. Was that the one you were referring to? Okay, cool. Yeah, because I get confused with the other one. That there's another one for ADHD, which is the interview. Okay, it's called the ACE. So I was like, yeah, confused. Okay, great. So what do you guys do in terms of that? I know ADHD and some of these things required, or I don't know. I'm not gonna put required, right? But there's some thoughts around ADHD or certain things that need further testing. In primary care, most people don't do testing, right? And people are coming to us because they want treatment, they want medication. What are what's your approach? What's your clinic's approach, or in terms of that? Like, how do you manage that in your clinics? Pretty sure you guys have to have, I mean, I don't know if it's where I'm like where my state, but pretty sure a lot of people right now are dealing with that, right? Like a lot of people getting a lot of knowledge around that and wanting to know during adulthood if they actually have ADHD or not.
Well, one, I guess my take on it is, so I typically have a non-pathologizing kind of way of looking at it. Nonetheless, I think it is useful to provide psychoeducation a lot of the times. So I spend a lot of that time, at least initially, when I notice certain things, especially with adults undiagnosed ADHD, just to kind of plant the seed of maybe for you to explore that on your own as a client. But yeah, I think psychoeducation is huge.
Okay. Anyone else wants to share about their experience with this. So yeah, basically, yes, I would say most people want to know, and our clinic, at least, we do require some sort of testing or objective measures for that. So we tend to refer them out places who could do that and provide that, or if they have records of evaluation that was completed. I do know of other places that do require the behavioral health team to kind of do a diagnostic interview and assess for symptoms and provide a diagnosis or rule it out, which can be complicated. What are some of the challenges with that, Federico? Like, you know, patient coming, did they typically feel okay respond well to that approach of kind of leading them psychoeducation and leading them to explore that on their own a little bit?
Yeah, they do respond well because most of the time it helps kind of name, find the thing that's going on within me. Especially if they don't have any kind of, I don't know, like not to sound cruel here, but no kind of education behind mental health or that, relationship dynamics and things of that nature. I work with a lot of couples, and so there's a lot of undiagnosed ADHD in males, unfortunately, at least in my experience, has been that. And sometimes to even identify with some of that as a man, cisgendered male, it's kind of hard sometimes too. And but it helps it coming from another cisgendered male that's the case, and it almost empowers them to say, you know what, well, maybe I do go need to talk to a doctor, kind of thing. And so it helps, but then also you can see the sense of relief on the wife's side of things, where she's like, oh, finally somebody said something that made sense. And they go with it. But then I've seen a handful that are still resistant to a lot of that, which is fine, and again, I don't condone either way. It's just, hey, this is just information that's out there. We go along with the DSM, and these are the things, the criteria, and you go and forth and do something with that information yourself if you want to. But I know that it has implications in relational dynamics, so it's worth looking into, but it's up to them if they do or don't.
Definitely. Good. So I think, yes, a lot of people don't know, and kind of providing that psychoeducation and them on understanding it's helpful by itself sometimes. Also, I think, I was thinking while you were saying that, that not everyone that has that might need medication for it or anything, so that's also a good thing, to let them know, right? If there's not, they don't need it at the time, there are other things that they can try behaviorally, right? Or behavioral wise, and that's the right way of saying it. So yeah, that could be a powerful tool. All of you guys, I know there's different models of integration. I don't know if you guys are performing any type of therapy sessions, no therapy sessions at all, like screening consultations. I'm not sure. Are you doing all of it, or a little bit of, like, how does that look in your place of work?
So we're trying to implement PCBH into our primary care clinic and our gynecology clinics. We also have specialists, but at this point it's just me. So it's just me available during basically primary care clinics. I guess our challenge is that we are not an FQHC, so we don't have full-time staff as our providers. Our providers are volunteer. So that requires us to be a little bit more flexible. And we also have like one psychiatrist. So it can be tough when we have folks coming in that need a psychologist or a psychiatrist. So, relying on referral networks, of course, connecting people to long-term therapy services, but having the BHC to meet people in the moment provide that short-term care, sometimes gap services. So for whatever reason, if they're not able or willing to connect with long-term therapy, there's still something for them to access. So that's kind of the model that we've been trying to implement for the past like 10 months. But recognizing too that our scale is a lot different than an FQHC because of our size, and our volume of patients is a lot lower.
Okay. Yeah, that makes sense. I mean, if you're having maybe a smaller clinic or system in general, still valuable, like to be able to bridge that care and provide and identifying things that would go unnoticed, right? Like, hey, this might be going on, and providing those resources and help them connect. Yeah, that's and I ask because obviously that also marks what you're doing, right? Like, do you want to assess further, or are you just focusing on identifying if this is something that requires treatment and then connecting them? So that definitely makes a difference, of course, right? And in the tools that you're going to be using as well. Because in that case, I was thinking you're not diagnosing necessarily, right? You're looking for identifying something, and then possibly someone
Right.
else would be
Right.
providing. Yeah.
Yeah, even within like the boundaries of time, you know, typically we just don't have enough information to
Yeah, of
provide an
course.
actual diagnosis.
Yeah, that's good. I mean, and that's a good thing too to talk about. I guess with the screening tools, they're not diagnostic tools, right? They're screening tools, so it helps you know if something's going on, and might help you identify the course of treatment or the recommendations they're gonna make, but they're not necessarily gonna tell you that, oh yeah, PHQ-9 is 5. That means they're depressed, and when you look at this, they don't meet criteria necessarily, right? Because it's not. They say yes, do other stuff, but not the first two, for example. I don't know. So things like that. So that's also a good thing to take into consideration as well. So, yeah. What have been your challenges, I guess, when working with the Latinx population in your clinics and trying to find screener tools that work for them? Have you found that they're available and that you can, or how has that experience been for you guys? You feel they're useful at all? Do you feel they are actually, like people can actually, like, from your population, understand them and fill them out, and it reflects what they're really experiencing? What has your experience been?
Well, for me, I guess two things. One of the challenges is, of course, I'm an insurance-based practice, so finding the diagnosis to file insurance with at session 1, 2, and 3 kind of thing, when I haven't really done the work to really see the whole picture. And then when you slap, a diagnosis of, general anxiety disorder, for example, and them not having the knowledge of how insurance works, let alone getting a diagnosis and what the implications that might have on future situations with their health records, that has been a challenge. But again, psychoeducation is major. A lot of times, I guess I just struggle with giving that diagnosis because I know the implication that'll have. I tend to use the adjustment disorder diagnostic thing to be just more on the safe side. And if it needs further clarification or rule out of certain things, then I'll definitely refer them out to other providers, psychiatrists, psychologists, or even their primary care. Typically not, because they're not very versed in mental health, but just somebody specialized in mental health. So kind of like what Daniela said, that resource, the referral network, having especially around this area, that are one, Spanish speaking or Spanish speaking friendly, or have some kind of translation service. That's also been another hurdle. Let alone in Texas. I mean, we have a huge Latin population. So it's not fun. It's not about finding capable ones. It's just that some of these smaller maybe like mom and pop kind of stuff don't have those resources to have translation services. So then it becomes an issue about that. So, but more than not, they usually go to a hospital or, a primary care clinic for those kinds of things. That's the unfortunate thing. They're not really going to the psychiatrist, a psychologist. But I think even because I see like older teens, like 17, 18 kind of teens. And a lot of times it's like, what's wrong with my child? Tell me what's wrong with them. But it's really not even the child, it's more about the parents' own anxiety. So I'm just like, well, there's nothing wrong. Your child's just being a child, a teen kind of thing, So educating about that and life transition stuff. So it's a lot, but nonetheless, I'm able to manage it in the little pods here and there.
Yeah. That's the nice thing about primary care, right? That if you notice that, I don't know what you guys think, but I'm like, are you also a patient of to the mom? Do you want to talk to someone and then have them engage with someone else too, so they can also work with that, right? And they can get the service that they need, because obviously, right, they're also having some anxiety symptoms or experiencing some anxiety. So I like that a lot about primary care, that you can see that and catch that when and also provide service and help them with that. So yeah, definitely. I think the same thing here, right? That there are a lot of people who need a longer or higher level of care than the one that can provide here in primary care. So sometimes it's hard connecting them. Sometimes there are no resources or limited resources outside. They have to wait a lot, and you have to bridge care and continue, to find or work on partnership with the community out there, so they can access and have the services that they need, because definitely can't. So yes. Good. So anything else you guys feel that you want to questions or thoughts? No? Good. So I think we can leave it here. Thank you guys for sharing and being here with us. Next month we're having planning a conversation, having someone talk about possibly her experience as a native English speaker serving the Latinx population, right? Because they don't know the language, but there's a high need as well. So we're thinking about that, and we're thinking about other stuff. So we'll share more information about what's coming for the next month. So if you could join, that would be great. Yeah, so feel free to send questions if you have. I don't know. Yeah, if you need I don't know, anything, and then we'll be here next month as well. Next time will be an hour before, so at noon for me. I don't know what time would be for you guys, but it's like no, like an hour for earlier. That's what I wanted to say.
Awesome. Thank you so much.
Great. Thank you. Hope you have a good rest of your day, and thank you everyone for sharing. And yeah, hope you have a good day. See you
Thanks, you
next
too.
time. Bye.